You have reached the final lesson in this program, and this session covers the topic of depression. Research has shown that there is a link between depression and asthma. In fact, having severe asthma more than doubles the risk of developing depression. Around 1 in 5 women and 1 in 8 men will experience depression in their life, and these numbers are even higher in people with asthma. It's normal to feel sad every once in a while, but if you have asthma and you find yourself struggling with depression on a regular basis, you could be one of the many people who find that these two conditions are difficult to separate. Depression is a serious health condition, not just a low mood. People with depression can have trouble doing normal activities, and it can have serious effects on mental and physical health. The word depressed is a common everyday word. People might say, "I'm depressed," when in fact they mean, "I'm fed up because I've had a row or failed an exam or lost my job." These ups and downs of life are common and normal. These feelings usually pass quite quickly. With true depression, you have a low mood and other symptoms each day for at least 2 weeks. You might find everyday activities hard to cope with, or have physical symptoms such as sleeplessness, a lack of energy, general aches and pains, or muscle tension. Depression can be triggered by events such as bereavement, divorce, redundancy, and long-term illness. Some people get depressed in the winter due to a lack of natural light. This is known as seasonal affective disorder, otherwise known as SAD. On the screen now, you will see a list of the common symptoms of depression for you to use as a checklist. These include feelings of tiredness or lacking in energy. You could be feeling low or sad for a long time. You may not be sleeping well. You may be feeling tearful. You may not want to be with people. You could be feeling angry with people. Or you may not want to do things. You could be eating, drinking, or sleeping more or less than usual. Also, you could be using alcohol or drugs or smoking more than usual. You could be finding it hard to cope with everyday things, or feeling restless or agitated and anxious. You might not be taking care of yourself. You could find you cannot concentrate, or you have feelings of guilt and blaming yourself for things. Also, you might lack confidence, or have physical aches and pains. These could include changes to your menstrual cycle. You might be feeling negative with a bleak outlook, or simply unable to enjoy things you usually enjoy. If you recognize some of these in yourself, you should talk to someone about how you feel, perhaps a partner, someone in your family, or a friend. It's important to seek help if you are worried about feelings or symptoms that are going on too long, particularly if they are having an effect on your everyday life. You might want to consider if your asthma is making you depressed. Everyone reacts differently to an illness or long-term condition. For some people, having asthma can result in anxiety, fear, and even shame. It can lead to problems in other areas of their life, such as work, worrying about taking sick leave, for example, and college, and missing exams. Having asthma can be worrying, especially if it's new to you, or if you experience a lot of difficult symptoms a lot of the time, or if you have had a diagnosis of severe asthma and are living with severe symptoms all the time. Some studies suggest that depression is 2 to 3 times more common in people with chronic illnesses or long-term conditions. However, with good support, most people will be able to manage their asthma without it disrupting daily life, and they are good examples of people with asthma leading full and active lives, working, socializing, and able to stay well and active. For most people with asthma, it doesn't need to be something to be depressed about. However, if leading a full and active life seems like a far-off goal to you right now, or you're unsure or afraid of a new diagnosis, you should get some support for your asthma. Don't think you have to put up with worsening symptoms and poor asthma control. You could ask your doctor for advice, particularly if you are newly diagnosed and aren't sure what having asthma is going to mean for you. You should see your doctor at least once a year to talk about your asthma. Make sure you develop a written personal asthma action plan with your doctor so you can feel more in control of your asthma symptoms. Moving away from depression is not an easy thing, but taking small steps at a time and keeping an open mind about the support available to you will eventually lead you towards a better outlook. Thank you for your participation so far, and see you at the next video.